You listed off earlier some of the criteria for advancing the state under your Safe Start plan from Phase 3 to Phase 4. You mentioned things like decline more sharply, percent positivity decreasing, healthcare capacity continues to strengthen. The same is kind of true moving from 4 to 5. These seem very subjective standards. Why not put forth some numerical threshold that say, okay, when we get to this percent of positive case tests, or this number of new cases, or this number of deaths, that's when we move so that everyone can see, okay, here's the line we need to get to.
So a couple of things, and then if you want to add something, feel free, Dr. J. This is a novel virus. So COVID-19 is a virus unlike anything anyone's seen before. We are learning a tremendous amount in a very short period of time. We know, we're in a much better position today than we were 4 weeks ago. Definitely 4 weeks ago we were worse off than we were 4 weeks before that. Where we will be in 4 weeks, I don't think anyone can predict. What we do know is that if we keep observing these best practices, we're going to get stronger. We're going to be in a better position to start continuing to re-engage. There's no textbook specific number that will tell you it is safe to re-engage a particular sector of the economy. It depends on human nature. It depends on human activity. It depends on the appropriate protocols and the access to PPE for sectors of the economy. And so there are a lot of variables into this equation. We do know that when our testing gets to 15,000 to 20,000, 25,000 a day, we'll be in a much stronger position to take that next step. But our ability to do those tests is dependent on things that are not necessarily in our control. For instance, we've been really grateful that the federal government has been able to give us additional testing implements, the swabs. We were anticipating a delivery this week of tens of thousands of swabs, of very varying types of swabs. We know that different tests require different kinds of swabs, and I know people are tired of swabs. What is so complicated about a swab? They're not that complicated, but each of these tests depend on a specific type of swab. And so when our shipment from the federal government comes and it is 100% foam swabs, it means we can't execute those for all of these other tests that we have. And so it complicates our ability to meet that number so that we have a robust assessment of where we are. And so the hardship of saying by this date certain we are going to take this next step, by this particular measurement we're going to be in position to take this next step. There are a variety of things that we are looking at. I think that, in the coming days you'll be better able to assess what these next thresholds are to get into the next phase, and we will be in a stronger position to determine what that needs to look like. But there's a lot of, this is science, and this is the practice of epidemiology, and I am listening to the best minds in public health and our health systems across the state and in medicine. Dr. J, anything you want to add?
Sure. I'll just say, similar to the practice of medicine, and when I teach my residents, even though we use evidence-based medicine and there's all kinds of formulas for what you should do for a patient, people are not cut and dry. You have to look at the context of what someone is presenting in front of you. So there's no special formula that will tell us how and when to reopen. I can say, for example, we may see a certain level of cases in a particular region, but you have to dive in. Is that associated with a particular facility, a nursing facility, or a workplace, or is it that it's just broad community spread? So a number won't necessarily tell you that. We have to look at the context, and we'll continue to do that, looking at all these various variables.